Good evening, folks. Tonight's topic, A, is the article's titled "Long COVID is More Than Just Fatigue." Our new study suggests its impact is similar to a stroke or Parkinson's disease. Okay, I'm going to get into that for you now. Key findings from the study. Long COVID's impact is profound. The study reveals that long COVID can severely disrupt daily life with effects comparable to neurological conditions like stroke or Parkinson's disease beyond common symptoms. While fatigue, brain fog, and breathlessness are widely reported, the study emphasizes how these symptoms interfere with basic functioning and autonomy. Understudied in Australia. The research fills a gap in understanding how long COVID affects Australians, specifically especially in terms of lived experiences and daily limitations. Scope and scale affects 6% COVID patients. Long COVID is defined by the World Health Organization as symptoms persisting for at least 3 months post infection. Over 200 symptoms documented. These vary widely, making diagnosis and treatment complex. Long haulers. Some individuals experience symptoms for years, not just months. Ongoing challenges. Diagnostic ambiguity. The variability in symptoms has led to debate over what long COVID truly is, its causes, and even its legitimacy in some circles. Need for holistic support. The study underscores the importance of recognizing long COVID as a serious, debilitating condition requiring systematic healthcare responses. Would you like to explore how this research might inform culturally responsive care models or myth-busting resources for your toolkits? The implications of long COVID for healthcare systems are profound and multifaceted. multifaceted. Based on the study findings, here's a breakdown of key impacts. Systematic implications for healthcare. Okay. One, recognition of long COVID as a debilitating condition. Long COVID's effects are comparable to stroke or Parkinson's, demanding that healthcare systems treat it as a serious chronic illness, not just lingering fatigue. This reframing requires updated diagnostic criteria and disability assessments to reflect the full spectrum of symptoms. 2. Need for multidisciplinary care models. With over 200 documented symptoms ranging from neurological to respiratory and psychological, solo care is insufficient. Integrated teams, neurologists, pulmonologists, and psychologists, occupational therapists are essential for effective management. Expansion of rehabilitation services. Many patients experience long-term functional impairments requiring physical, cognitive, and vocational rehabilitation. Sometimes our systems must scale up rehab infrastructure, especially in underserved or rural areas. Training and awareness for clinicians. Okay, diagnostic ambiguity has led to skepticism and underdiagnosis. Clinicians need training to recognize diverse presentations and avoid dismissing symptoms as psychosomatic or exacerbated. Equity and access considerations. Marginalized populations may face barriers to diagnosis, treatment, and support. Culturally responsive outreach and care models are vital to ensure equitable access and avoid deepening health disparities. Data collection and surveillance. Long COVID's prevalence, 6% COVID patients and vulnerabilities demand robust tracking systems. Improved data can guide resource allocation, policy decisions, and future research. Would you like to co-design a framework for integrating long COVID care into existing aging and cognitive health programs? We could explore participatory models that center lived experience and community wisdom based on the study's findings and broader systematic gaps. Here are several policy interventions that could meaningfully improve long COVID care. All right, give me 1 second, guys. Specific policy recommendations. Okay. Formal recognition and classification. Policy. Classify long COVID as a chronic debilitating condition within national health systems. Impact. Enables access to disability benefits, workplace accommodations, and long-term care planning. Multidisciplinary care mandates. Policy funded and required integrated care teams, neurology, pulmonology, psychology, and rehab for long COVID clinics. Impacts. Reduces fragmentation and improves outcomes for patients with complex multi-system symptoms. Clinician training and classification. Policy. Develop continuing education modules on long COVID diagnosis and management. Impact. Reduces misdiagnosis and stigma, especially for marginalized groups, often dismissed or overlooked. Culturally responsive outreach. Invest in community-based programs that tailor education, screenings, and care to diverse populations. Impact. Improves equity and trust, particularly in underserved and rural areas, rural communities. Then you have rehabilitation access expansion. Okay, I'm going to go through that for you now. Give me 1 second. Gotta get paper parts. Okay, hold on. Policy subsidies, physical, cognitive, and occupational rehab services for long-term our long COVID patients. Impact supports recovery and reintegration into daily life and work. National surveillance and data systems policy. Establish registries and longitudinal tracking for long COVID cases. Impact informs resource allocation, research priorities, and policy adjustments over time. Workspace protections. Policy update labor laws to include flexible scheduling, remote work options, and job security for long COVID sufferers. Impact presents economic fallout and supports sustained employment. Would you like to co-develop a policy brief or implementation guide tailored to rural aging populations or culturally specific care models? We could integrate these recommendations into your existing frameworks. Several countries have taken initiatives and effective steps to address long COVID, offering vulnerable models for policy adaptation. Here are standout examples from around the world. Successful long COVID policies by country. Okay, guys, now I'm going to go through these for you. United Kingdom policy established over 100 dedicated long COVID clinics through the NHS. Features multidisciplinary teams, standardized referral pathways, and integration with primary care. Impact improved access and community of care model now informing EU strategies. Germany policy funded research centers and rehabilitation programs specifically for long COVID. Features emphasis on neurocognitive rehab and return to work support. That's Germany, folks. Okay, let's see. Okay. Impact, strong data infrastructure supports ongoing policy refinement and patient tracking. Canada, provincial health systems launched long COVID networks with patient-led advisory boards. Features co-designed care pathways, culturally responsive outreach in Indigenous communities. Impact, increased trust and uptake among marginalized populations. Okay, Netherlands policy, insurance coverage extended to long COVID rehab and mental health services. Features: seamless integration with disability benefits and workplace accommodations. Impact: reduce economic fallout and improved reintegration outcomes. AU Australia policy national guidelines for long COVID care, published with input from clinicians and patients. Features: emphasis on equity, telehealth access, and rural outreach. Impact: consistent care standards across states and territories. Sweden, regional health authorities develop long COVID registries and digital symptom tracking tools. Features: focus on self-management, remote monitoring, and early interventions. Enhanced data-driven care and reduced hospital burden. If you would like to explore how these policies could be adapted for rural aging populations or integrated into participatory toolkits, we could co-design a comparative framework that aligns with your infrastructure and equity goals. Excellent follow-up. Even the most forward-thinking long COVID policies have faced significant hurdles. Here's a breakdown of common challenges across the countries we discussed. Okay, give me a second, guys. Okay. Features: focus on self-management and remote monitoring and early intervention. Impact: enhanced data-driven care and reduced hospital burden. Okay, that one I read. Cross-country implementation challenges. Fragmented health systems. Example: in Canada, provincial variations led to uneven access and inconsistent care standards across regions. Impact: patients in rural or underserved areas often lacked specialized services or clear referral pathways, clinician knowledge gaps. In the UK and Germany, many providers were unfamiliar with long COVID's multi-system nature, leading to misdiagnosis and dismissal. Okay, impact, delayed treatment and increased patient frustration, especially among marginalized groups. Data infrastructure limitations. Example, Sweden's digital system or system tracking tools were promising but lacked integration with national registries. Okay, impact, incomplete surveillance and difficulty evaluating policy effectiveness, workforce shortage. For example, Australia and Netherlands struggle to staff multidisciplinary clinics due to burnout and limited training pipelines. Impact, long wait times and reduced community care. Quality and access barriers. Indigenous communities in Canada and remote populations in Australia faced cultural and logistical barriers to care. Impact, lower uptake of services and poor outcomes despite policy intent. Policy coordination and adaptation. Okay, example, EU countries found that similar measures had vast differences or different outcomes depending on timing, sequence, and local content. Impact, highlighted the need for adaptive, locally informed implementation strategies. Economic and political constraints. Okay, some regions in Germany and the UK faced budgetary pushbacks or political resistance to long COVID or long-term disability recognition. Impact, undermine sustainability and scope of care programs. Would you like to co-map these challenges to U.S. infrastructure gaps or explore participatory strategies for overcoming them in rural aging contexts? We could build a comprehensive implementation guide that aligns with your systems level work. The implementation challenges faced by countries enrolling out long COVID policies have had direct and often profound effects on patient outcomes. Here's a a synthesis of how these barriers translate into real world consequences. Impact of implementation, challenges on patient outcomes, delayed diagnosis and mismanagement cause clinician knowledge gaps and diagnostic ambiguity. Patients often go months or years without proper recognition or treatment, worsening symptoms and increasing psychological distress. Fragmented and inaccessible care cause sole health system and uneven regional infrastructure affect patients, especially in rural or underserved areas, struggling to access multidisciplinary care, leading to incomplete or ineffective treatments. Reduced functional capacity cause limited access to rehabilitation services and coordinated supports. Affect many patients report being unable to perform daily tasks, with some experiencing disability levels comparable to stroke or Parkinson's disease. Economic and social disruption cause lack of workspace protections and flexible labor law or labor policies. Affect patients face job loss, income instability, and social isolation, compounding health challenges. Widening health inadequacies cause cultural and logistical barriers in marginalized communities. Affect disparities in care across quality, exacerbate long-term care outcomes for indigenous, minority, and low-income populations. Psychological toll and stigma cause public and clinical skepticism about long COVID's legitimacy. Affect patients report feeling dismissed or gaslit, which undermines trust and mental health and delays engagement with care systems. Would you like to co-create a patient-centered outcomes framework that integrates these insights into your aging and cognitive health toolkits? We could build in hold on, one more page. Participatory matrix and culturally adaptive evaluation strategies. Okay, guys, so that is A for you. I'll try and do a B in a little bit. For now, Gator Wellness, take care, folks.